Treatment can be both comprehensive and local. Well, in the early stages of thrush or candidiasis, yes, we always try to start with local treatment first. These can be antimycotics, antifungal medications, or imidazoles in the form of solutions, aerosols, or gels. A 1 or 2% aqueous solution of methylene blue is also very often used. This is mainly prescribed for children, especially during infancy, because this solution can be swallowed. It's an aqueous solution, so there aren't really any warnings in that regard. But, well, Lugol's solution works better, of course. If it's used for children when the condition is more severe, then it's diluted 1 or 2 times, maybe even 3, especially if the children are very young. A modern antiseptic is a 0.05% solution of chlorhexidine biglycinate. A 0.1% solution of encetidine is also often used for rinsing the mouth. This solution is used to rinse for 30 to 60 seconds, so it's really quick. Just rinse once or twice, and that's enough. But only after meals and not too often, about twice a day, and it shouldn't be swallowed. The main thing, too, is alkalizing with baking soda. So you make a baking soda solution, and you also rinse your mouth with it. And with this same solution, you disinfect children's pacifiers, bottles, rubber toys they play with, or plastic toys. This is to prevent infection. During the treatment period, carbohydrates must be eliminated from the diet. This is very important because any sweets in any form, yes, they promote the development of fungal infections. So no sweets of any kind, no honey, no cookies, cocoa, or chocolate. Also, avoid spicy foods, but mainly sweets. And we observe. So this local treatment is carried out for about a week, and we observe. If there is a good result, great, that's enough. If it's not quite enough, then we use the children's form of Futsas, which is fluconazole. It's soluble. It gets diluted and given to children according to their age and the appropriate regimen. So everything is individualized. In addition to local treatment, yes, for adults, well, basically, the same solutions can be used for adults as well. It's also recommended to use antifungals that are taken orally. As a rule, that's natamycin or the well-known pimifussin. It's also used from the age of 3, so it can be given to children as well. On average, the course lasts about 5 to 7 days, but again, everything is very individual, depending on age and all that needs to be considered. Fluconazole or difluzol or diflucan or flucostat, these kinds of medications, they all belong to the same group. It's a fairly powerful broad-spectrum antifungal drug that works against all subtypes of Candida fungi, and they come in dosages of 50, 100, or 150 milligrams. Again, the dosage depends on age and the severity of the condition. In addition to these medications, miconazole is also recommended. It comes in a dosage of 250 milligrams, and it's usually taken for 3 consecutive days after meals for adults. And ketoconazole is also a good medication, very good and effective. It's recommended for 5 days at a dose of 100 milligrams twice a day after meals. For chronic forms of oral candidiasis, additional immunomodulators are also recommended, such as cycloferon, immunofan, and polyoxidonium. Cycloferon and Immunofan are administered intramuscularly, and cycloferon also comes in tablet form. Polyoxidonium is also available in tablet form and can be given to children. Alternatively, polyoxidonium can be diluted and given as drops according to age, as appropriate. For adults, polyoxidonium can be administered intravenously as a drip. It is a very powerful and highly effective medication. As for folk remedies, they can also be used in this situation. A good remedy for the oral cavity is a decoction of oak bark, meaning the ingredients are oak bark, St. John's wort infusion, calendula, and chamomile. All of this is infused together, and you can also add a small amount of apple cider vinegar, just a couple of drops. And this kind of solution, this decoction, can also be used as a mouth rinse. Pediatricians also recommend Candide cream for children. It's harmless and can be applied to the oral mucosa, even 2 or 3 times a day for 7 to 10 days. There's also Myramistin, which comes as a solution that needs to be diluted heavily for use as a mouth rinse. And as an ointment, it's also harmless. You should apply it in a thin layer to the mucous membranes. It's absolutely harmless. There's also a widely used medication called stomatofit. It's also herbal, used for rinsing the mouth, and can be given to children from 6 years old. Those are the recommendations.